Hello guys, welcome back. Today we will discuss about other psychiatric topic, that is sexual disorder and dysfunctions in psychiatry. There are a lot of sexual disorders and dysfunctions, and paraphilias, that means atypical sexual interests, can affect every day-to-day functioning of an individual. In fact, most of the people are not ready to discuss about these problems. When we go to the root of the problems, we can see a lot of psychiatric and psychological reasons behind most of the sexual disorders. So it is a topic to be discussed. So what is sexuality? So sexuality means our inherent capacity to experience pleasure from sexual activity. In fact, there is no right or wrong way to experience sexuality as long as it gets difficulty. Sexuality is closely connected to our thoughts, feelings, and behaviors, and it can either positively or negatively affect our physical and mental health. So what is sexual dysfunction or disorder? It is a significant challenges towards our ability to experience pleasure from sexual activity. The major signs are difficulty with sexual activity and lack of pleasure. But always keep one point in your mind, that not everyone who is experiencing changes in their sexual thoughts has sexual dysfunction, because our sexual feeling and behavior will get changed based on our age change. So that point just always keep in your mind, guys. Those who are showing changes in the sexual thought has sexual dysfunction, like that, don't think, because based on our age, our sexual thoughts and sexual behavior also will get changed. While coming to the type of sexual disorder or dysfunction, basically we can see four categories. They are desire disorder, that means low sexual interest or desire; arousal disorder, that means low physical inability to become sexually aroused; orgasm disorder, that means delay or absence of orgasm; and pain disorder, that means physical discomfort and pain during sexual activity. Well, coming to the sexual disorder, some disorder we can see only in male and some disorder only we can see in female. The sexual disorders that affect only male are premature ejaculation disorder, erectile disorder, and male hypoactive sexual desire disorder. While coming to female, some disorder that only affect females are female sexual arousal disorder, GENITO pain disorder, and orgasmic disorder. Then while coming to some other disorders, exhibitionism, fetishism, Frotteurism, masochism, sadism, transvestic disorder, and voyeuristic disorder. All these things we'll discuss in the future slide. The first thing is premature ejaculation disorder, that only we can see in male. So it means male ejaculates too quickly during sexual intercourse. Occasional episodes of premature ejaculations are common, but if it is always happening, means that time it is considering as a disorder. Occasional episodes of premature ejaculations are common thing, but if it is always happening, means more than 6 months continuously it is happening, means that time it is considering as a disorder. There are psychological and physiological reasons behind this condition. While coming to the physical reasons, the most common reasons are prostate problem, thyroid problems, and drugs are the common physiological problem. That means excessive use of drugs. But our main focus is psychological problem. The psychological problem include anxiety, depression, stress, traumatic childhood sexual experience, and strict and abridged sexual belief. While coming to the treatment modality, cognitive behavioral therapy is the major treatment aspect, which helps to change the maladaptive sexual behavior to adaptive sexual behavior. And 3 steps we can see in this treatment. First thing is addressing the unhelpful thought. Second thing is establishment of partner relationship, a healthy relationship with partner. Then teaching the adaptive behavior for delaying the ejaculation. So these 3 steps mainly we can see in CBT therapy, and it is literally very effective type of treatment. Then medication. Some medications also we will use in the case of these conditions. It include antidepressant drugs to reduce the level of depression and anxiety. Example, paroxetine, sertraline, and fluoxetine. These are the most commonly used antidepressants or selective serotonin reuptake inhibitors. And you can expect some side effects, as I said in the antipsychotic drugs or psychotropic drugs video. There are many side effects we can see for psychiatric drugs, but still it is effective to some extent. Then next type of disorder is erectile disorder or impotence. Means recurrent or persistent inability to attain or to maintain an adequate erection until the completion of sexual activity. And it is a common problem after 40. So it is not a disorder. It is a common problem based on the age. That's what I told you in the first video itself. All the sexual behavior changes are sexual dysfunction, sexual disorder, like that. Don't think. Depend upon our age, there are a lot of changes will come in your sexual activities and sexual behavior. Stress, tiredness, anxiety, and drinking too much alcohol are the common cause behind this. Erectile dysfunction can create problems in interpersonal relationship. That is the problem of this condition, interpersonal relationship problem. But it is not a big disorder as it is a part of aging. Well, coming to the treatment, what we supposed to do means some basic remedies we can do, like maintain the blood pressure level or take a measures to lower the blood pressure. Then hormone replacement therapy, reduce the weight, avoid alcohol and smoke, eat healthy food, do regular exercise, and try to reduce the stress and anxiety. Medicines such as sildenafil, that means Viagra, is also often used by the doctors to treat erectile dysfunction, and you no need prescription to get this medication. Sometimes doctors will suggest, and without prescription also we can take this medication. And other similar medications include tadalafil and varantafil and avanfil. Okay, these medications you can take, but you need a prescription to get this drugs. The next thing is male hypoactive sexual desire disorder. Male hypoactive sexual desire disorder. It means low sexual desire. So it is also known as low sexual desire disorder. If sexual dysfunction persists for at least 6 months, then we can consider it as male hypoactive sexual desire disorder. Okay, the situation need to continue for at least 6 months. Persistently, it need to continue for 6 months. Then only we can consider it as a disorder. It is characterized by reduced interest in sex and sexual activities and unaroused sexual stimulation. The reasons include mental health problems, stress, anxiety, medical problems like multiple sclerosis, use of alcohol, substances, etc. And the treatment include counseling and medication. So one point always just keep in your mind, guys, that continuous persistent symptoms for at least 6 months the patient or the person need to show. Then only we can consider it as a disorder. Next, female sexual interest arousal disorder means their body does not respond to sexual stimulation or lack of desire for sexual activity. The symptoms include decreased sexual desire, less thought about sexual activity, decreased pleasure, and lack of sensations during sex. The psychological reasons include anxiety, stress, poor body image, relationship problems, negative thought, and trauma. So psychological problems are playing a major role in this condition. Because of psychological problems only, mainly this problem arises in female. Apart from that, menopause, pregnancy, and hormonal problems also sometimes leads to this. Next thing is genitopelvic pain and penetration disorder, and it is characterized by persistent or recurrent difficulties towards vaginal penetration for at least 6 months. For continuous 6 months, along with intense fear and anxiety during vaginal intercourse, pain in pelvis or vulvovaginal area during intercourse, and tightening of lower pelvic or inner abdominal muscles during penetration. So these symptoms continuing for at least 6 months, then it is considering as genitopelvic pain and penetration disorder. And the causes include post-traumatic stress disorders, relationship distress, domestic violence, and any other medical condition. So here also psychological problems are playing a major role. Psychological problems are the major reasons behind this condition, like that we can see. So psychological problems have a major role towards the sexual dysfunction and sexual disorders. So the next thing is exhibitionism. That means a period of at least 6 months recurrent intense sexually arousing fantasies or sexual behavior like exposure of one's genitals to an unsuspecting stranger. In some cases, the individual will have fantasy that the stranger also will have become sexually aroused, and the onset is before 18 years also we can see. And always one point, just keep it in your mind guys, at least for 6 months the person need to show the symptoms, need to show this behavior, then only we can consider it as a disorder. Next is fetishistic disorder. So what does fetishism means? The use of inanimate objects or non-genitalia objects for sexual arousal and sexual activity. And fetish become a disorder when they cause significant distress in our life as a result of this fetish activity. So what is fetishistic disorder means? It is a recurrent or persistent use of non-sexual body parts or inanimate objects to reach the sexual arousal to a point where our normal functions in our life will get disturbed. Until unless we can't say it is a disorder. Next is Frotteurism. Recurrent or persistent sexually arousing fantasies or sexual urge or behavior involving touching and rubbing against the concerned or non-consenting person over a period of at least 6 months without the permission, touching or rubbing other person's body, okay, without their permission, and the person need to show this behavior for at least 6 months, then only we can consider it as a disorder. Then masochism. Sexual masochism means taking erotic pleasure by receiving pain during sexual activity by being tied up, beaten or degraded verbally or biting, etc. By receiving pain, getting sexual pleasure means that is known as masochism. Next is sadism, that is just opposite of masochism. It is defined as taking erotic pleasure in inflicting or giving pain on others by doing impact play or degradation. So by giving pain. So masochism means by receiving pain and sadism means by giving pain to the partner. Sexual masochism and sadism are sometimes not the symptoms of mental health disorder. So that point is very, very important. There is a stigma still in people that it is a mental disorder, but sexual masochism and sadism are sometimes not the symptoms of mental disorder. Most of the people are still believing this, and so this is the time to stop the stigma because we are studying the sexual disorders and dysfunction. Sexual masochism and sadism are sometimes not the symptoms of mental health disorders. There will be some other reason behind this behavior, but sometimes it is a reason. It is a reason for mental disorder, but sometimes it is not a reason for mental disorder. So masochism means by receiving pain, sexual arousal, and sadism means just opposite of masochism. And Frotteurism means without the consent of a person touching their body parts and gaining and arousing sexual fantasies and sexual urge. And this behavior need to show for at least 6 months, then only we can consider it as a disorder. Next is transvestic disorder. Okay, recurrent and intense sexual arousal, urges and behavior from wearing clothes by the different gender for at least 6 months. The behavior need to show for at least 6 months. Wearing opposite genders dress is not a big mistake or it's not a fault, but wearing others dress, I mean opposite genders dress and arousing sexual pleasure, okay, or recurrent and intense sexual pleasure and arousal and urges occurring from that activity means that time it is considering it as a disorder, and this phenomena or the process need to show for at least 6 months, then only we can consider it as transvestic disorder. It is actually not a mental disorder instead, but it comes under paraphilia, that means atypical sexual thought. Cross-dressing. Okay, what does transvestism means? It is nothing but cross-dressing. Cross-dressing is not a disorder. Okay, it is nothing. It means wearing a dress conventionally designed for the another gender. It is not a disorder. Don't get confused. Transvestism, it is a not disorder. Okay, cross-dressing is not a disorder. But what is transvestic disorder means? When you feel sexually aroused from cross-dressing, and it is continuing for 6 months means then, and this problem or this behavior or this pattern of attitude is continuing for at least 6 months after wearing the opposite gender dress means that time we can consider it as a disorder. So cross dressing, it is not a mental disorder, it is a common thing. Okay, then Voyeuristic disorder, formerly known as voyeurism by Diagnostic and Statistic Manual of Disorders, for over a period of at least 6 months having recurrent intense sexually arousing fantasies or sexual urges or behavior involving the act of observing person who is naked in or in the process of disturbing or engaging in sexual activity. Observing other sexual activities and gaining sexual pleasure means that is known as voyeurism or voyeuristic disorder. But the person need to show this behavior for at least 6 months. Again the same point I'm telling. Okay, the symptoms need to continue, or the signs need to continue for at least 6 months in a continuous way, persistent way. Then only we can consider it as a disorder. So these are all some common sexual dysfunctions and disorder and atypical sexual thoughts of paraphilias which we can see. Okay, hope you understand, guys. Thank you.